Maupay nga aga, kumusta ka mo kada sugad nga panahon na nga tayo ang PIA Hour. Usa ka oras nga taramdan ang Philippine Information Agency nga nahatag ang eksakto na papanahon nga verifiable information nga makakabulig ga imo sangkay pagdesisyon. Ako Ninfa Quirante. Nga na ikaduha nga paypay naman na naton taramdan aton igkakahampang ang Regional Coordinator ang National Nutrition Council, Doc Kate Dutolyo. Ano ani raha Borongan or rather hamay dolong kay nagko-conduct rahin Barangay Nutrition Scholars Training ang aton ginsingabot ini nga panahon base makaistorya tabahin han kabutangan han nutrition han Eastern Samar. Aton ginwi welcome an or rather kay medyo maihanaya didi an aton kabatch dida ha Hernani ha Barangay Cancelidis Hernani Terry Candido. Hello, thank you very much. Sugad man ni ba naton nga batchmates si Mami Fe Hiluding, Mami Ludingan, Hinida, Almeda. Ngan aton liwat gin ko congratulate ano sang kahan niya nga semana in duha nga mga resorts and nag-open hin na bunggacious. Ang kakulop didi ha aventurer nga floating cottages didi ha Olot River. Sugad man didi naman ha Makati Island and sulat an Ohana Resort. Oni na may ada naton mga balita bahin iton. An aton mga sumat lokal. Yan na nga aga, natalibos na ang training. Han Retooled Community Service Program Core Team, han mga bungtuhan oras, San Policarpo, Taft, Maslog, Arteche, ngan Hipapad. Ngan adto na hirayana, ma-immerse ha Barangay Banoy han Borongan, para naman ira susion ang mga issues and concern han nasabi nga barangay. Igimpahamtang naman han Army and communist threat kundiin igin sumat ni Captain Ian Inot nga mas maupay na daw ang kamutangan han mga barangay. Darahan gindudumara nga RCSP kundi igin papatuman han na Task Force LCAC ang paghatag hin serbisyo bisan pa daw haduro katayaw nga mga barangay. Kumuharos waray na daw problema ha sur, adi na ma-focus ha northern towns ang plano gihapon buhaton mga taga-gobyerno ang pagpalatay, pagpaupay ang mga serbisyo han mga kalsada, tulay, pantalan, hapanalugon, barangays, ngan mga serbisyo medikal, social, ngan iba pa. Dako ang pagtuuhan Provincial Task Force LCAC Chair Governor Ben Ivardone nga diri na maiha magiging mamurayaw na kita. Samtang gintaga naman ang LGU Taft hinduha nga plake han NNC pinaagi kan Doc Kati Dutolyo. Nakita han National Nutrition Council ang kamaupahan performance han LGU Taft hanatan han nutrisyon. Siyahan gintagan han Certificate of Recognition darahan iya low level of stunting prevalence rate less than 20 kanan WHO cut-off points nga nakita didahan ira Operation Timbang. Ikaduha naman ang 80% OPT coverage nga naghatag kasiguruhan han nutrition surveillance sa kabataan nga 0 to 59 months. Dakon pasalamat ni Mayor Gina T. Han nga gintagos siya han NNC an ira paniguro bahin hanatad han nutrisyon. Iya gihapon igin pahamtang an iadako nga suporta han nutrisyon. Samtang nga pagbisita gihapon ni NNC Regional Director or Catalino Dutolyo han Borongan City kan Mayor Dayan Agda igin sumat ni Dutolyo ang duha nga dagko nga proyekto han nutrisyon kundiin kaapi ang syudad han Borongan han tutok kainan ngan multi-sectoral nutrition project nga nagmamalahimuhin agresibo nga pagsurapan malnutrition nga api haros ang tanan asa mga private food providers o sa ini nga coordinated package of nutrition specific interventions sa mga local governments. Nakadagihapon Konsehala Katrina Anakta Sadak nga usa gihapon nga proponent or advocate han proper nutrition. Para naman kan Mayor Agda kung kinahanglan daw ang counterpart, andam humatag ang syudad han counterpart. Ngani base matagan hin focus ang nutrition program gin-appoint mismo designate Jeddah 5 nga full-fledged nutrition action officer, tatagan hin opisina, staff ngan hold support. Samtang 714 naman nga bag-ong housing units para Yolanda victims ang gin-turnover ha National Housing Authority Didihan Hernani Mayor Amado Candidohan ika-14 Abril yan ang atuig. Ini nga mga housing units inaada gintindog ha barangay na nagaha. Ini nga 714 kundiin adto na nagbalhin ang mga mulupyo. Napili ini nga recipients kumuan ira mga balay ina wash out darahan Super Typhoon Yolanda. Kataliwan ang bagyo naghandong inihira ugaring dara nga aada danger zones. Hiranihan baybay, peligroso lagi hapon an ira kabutang. Yan na parahan mga recipients, labot la nga libre ini, kampante na an ira kamutangan, kumo marigo na an ira inuukyan. Dako an igin pasalamat ni Evangeline Tome Abueva usan mga recipients. Na-report naman ni Mayor Candido nga nahatag nag-request naman ni Mayor Candido nga mahatag hirahin school, matagan hirahin school, health center, daycare center, ngan playground kumo ining area in 1.5 kilometers tikang highway. Ini gitawag nga Hernani Townsville. Samtang banana boat ride, jet ski, surfing, boating ug iba pa nga water rides ang ginoopreser naman han Ohana Resort ha Islahan Makati Bungtuhan Sulat. Ang nasabi nga resort inag-abrihan Abril 13 nga gintambungan ini mismo ni Governor Ben Ivardone nga gipabag-uhi nga exciting adventure destination para dinhi. Kaupod ni Governor Ivardone ani kapikasan kinabuhi nga hi Madam Grace og mga media. Tikang naman ha barangay may Tigbaw Sulat, masakayhin pambot, tipakadto hini nga Islahan Makati haros usa ka oras. Kundi na opreser hinihin mga water sports activity. Kumo distansyado ha mga kabablayan, malimpyo ngandaw putli pa iton kabutanghan isla. Damo na ang mga resorts gihapon gintitindog ngan posible gihapon pagdaopon labinahan mga estehanon kung makuri pagdayo ha iba nga lugar darahan mga travel restrictions. Samtang haluyon naman han kalibre han mga barangay hakan avid han insurgency adi naman na ursa ang tourism development sa Malacan Basti Pumarejos an kan avid tourism officer. Daran paniguro ni LGU Mayor Taft Toytoy Hermino og Task Force and Local Communist Armed Conflict mahimyang na an kan avid ngandamo na an nahihimo nga mga negosyo. May ada hira Didi, bago pa lang nag-open kakulop, an Aventurer Floating Cottage Resort ni Jill Rivera. 5 ini nga mga floating cottages nga aada seaside han Olot River. Pwede daw magdarhin pagkaon ang mga excursionists ngan pwede gihapon kunwaray in mag-order hira ha tinatawag nga Aventurer Resto Bar kundiin idudulong mismo dida floating cottage an ira mga order ngan bestseller daw nira an calamares ngan sisig. Samtang mahihimo gihapon magpaluto hin mga lamang dagat pasamahan isda ngan iba pang seafoods didihan Aventurer Resto Bar. Naglalaman kan avid nga dara nga makuri maglalaag ha iba-iba nga mga area darahan travel restrictions mapakani ang mga labinan mga taga Eastern Samar pagpahalibway han ira mga igkasi resort destination din hila aton probinsya. Ang aton COVID update sang kay Eastern Samar hapag kaya na usa giwan ngan duha hasulat ngan an pagpahinumdum ha aton an mask iwas hugas plus bakuna sang kay Tapos naman, dili naman ha national scene na nawagan ang presidente han League of Provinces of the Philippines nga Presiderio Velasco nga unta, tugutan daw hira nga gumamit na lang rapid antigen test. Kay kumo daw ang PCR in Murumahal, tapos hirayo ang molecular laboratory nga naabot pahinduha nga din tulo ka adlaw ang resulta. Samtang, ang antigen test daw in Barato, dayon makukuha ang resulta nga naada daw ha local government unit nala ang pagtagad o pag-alin sa sunodhan mga nagpapositive hini nga COVID-19. Amo to sang kay naton mga sumat lokal ngan masunodan aton pakighampang Adinan aton bisita, hi Doc Catalino Dotolio. Keep it here on PIA Hour.
Kung problema mo hin kapaso it panahon, magtanom ka hindamo nga mga kahoy. Kung problema mo hin dagko nga mga baha, magtanom ka hindamo nga mga kahoy. Kung karuyag mo kumaon it mga prutas, magtanom ka it mga kahoy. Kung karuyag mo maaliw sa mga awit han mga katamsihan, magtanom ka it damo nga mga kahoy. Kung karuyag mo hin maupay nga kinabuhi, magtanom ka hindamo nga mga kahoy. Ibalik naton ang normal nga dalagan it panahon, pinaagi na aton pagtanom it mga kahoy. Ini po ani Obispo Bishop Crispin Vargas, the Bishop of the Diocese of Morongan.
Hadto anay, damo ang isda ang mga salog ug kadagatan. Malugsong kala ang mga sapa, makakapanikop ka na hin mga urang. Makadto kala ang mga kabakudlan, makakapanmurot ka na hin mga sihi, mga puruton, nga makakalibre hin panurasura ani mo pamilya. Yan na, oray na hini. Waray na panhinabot hini ang mga kabataan niya na. Harayo na iton mga kaisdaan. Susut na. Talagsa nala iton mga puruton haaton mga kabakudlan. Kay ano nga nasugad hini? Ang pangisda nga naagamit hindi nangita. O kundi man ang pangisda nga nagamit in mga hilo ug mga chemicals. Itong mga pesticides sa mga nga nalanay di ka nga mga uma, ngadtuhan mga salog ug kadagatan. Asya ini, ito nakakapuuhan kinabuhi ang mga sapa, ang mga salog ug kadagatan. May babalik pa ba ang kinabuhi ha katubigan? Bangin pwede ba? Kung kita mag-uurusa ng pag-ataman ang atong kalibungan.
Kamakailan lamang po ay lalathala na maraming Pilipino daw ay tumaraan sa sakit na depression. Tingin ko po ang depression ay parang sobrang kalungkutan, sobrang lumbay, na marami po ang dahilan kung bakit. Hindi ko po tatalakayin kung ano ang mga dahilan. Gusto ko pong talakayin kung ano talaga ang maaaring masabi ko tungkol sa depression. Tingin ko po kung tayo ay makikinig sa turo ng pananampalataya, ay mayroon po tayong magagawa tungkol sa depression. 3 bagay lamang po. Una, ang buhay ay pagsusulit lamang. Ang pagsusulit po ay hindi dapat tinatakasan o tinatalikdan, kundi hinaharap. Pangalawa, maraming pagsubok ang buhay, kailangan po nating maging matapang. At ito pong katapangang ito ay hindi galing sa paninindigan lang ng tao, ito po ay kaloob ng Diyos. Pangatlo, hindi po tayo nag-iisa. Ang kantang ito ay pagninilay-nilay sa sinabi ni Jesus bago siya bumalik sa langit. Sinabi niya, kasama ninyo ako sa lahat ng panahon.
Okay. Adin na kita sang kay Aden aton Regional Director ha National Nutrition Council, Doc Catalino Dotolio. Good morning, Doc.
Good morning, Ninfa, and good morning, handbugos nga istihano, no?
Okay. So, hey, Doc Cathy, naglilibot-libot yan kung may adahira yung train, Doc, ano nga mga barangay nutrition scholars, and then, naglibot hirapan pag-advocate gahapon pagpaupay nutrition, especially aton kabataan, Doc. Okay. And akong first question, and situation Eastern Visayas laanay, Doc. Ang nutrition situation in Eastern Visayas.
Actually, naton the nutrition situation no, in Eastern Visayas, no? So, naton 2020 Operation Timbang, no? Although very low ang atong EOPT coverage, na around 63%, no? So probably low, very low, no, or low. Pero that's better na kontrolhan mga 30, 28 in other region, but 63% is quite good na, no, amidst pandemic. Okay. So that's actually kaya lang there are cities, municipalities that had an OPT coverage beyond 80%, and we would like to commend these municipalities, no, particularly in Eastern Samar, nga nakakuhain hataas nga, kaya lang I cannot be very particular, pero may mga nagkakuhain hataas nga OPT coverage, around 80% and ababa. In fact, we have them recognized during the 2020 Regional Nutrition Awarding Ceremony held in the Oriental Hotel last March 30.
Okay. Okay. So, ano man ang igin pakita, Doc, aton hininga Operation Timbang? Ano ba ang sitwasyon aton kabataan?
Well, although we are on the right track, no, in terms of lowering down the stunting prevalence, no, in Eastern Visayas. Stunting or pagkabansot or habubo, no, and although wasting, we're quite doing well.
Ano wasting and kamagasa?
Ang pagkamagasa. No, thank you, Ninfa, no, for reminding the very highly technical.
Isang Cebuano speaking.
Yun, no? So, stunting, although we're on the right track, pero yun nga, sa pagkabansot or pagkahabubo, we really are crawling, no? But we hope to achieve, no, the global, the global target and even the country target of around 21.1% by the end of 2022. Kasi mataas talaga ang ating stunting way back 2008. It's around 42%. So we would like to have that after, commensurate with the Philippine Plan of Action for Nutrition 2017-2022 by around 21.1%. So mataas pa siya, pero pag hinati natin yan, mataas na din yung 20% natin na accomplishment for the 6 years period of the PPAN. No? So, we'll be hitting the target globally and nationally.
Okay. So, nga din naman kita, can we pwede bang i-compare yung situation naman ng Eastern Visayas sa Eastern Samar?
Well, comparing Eastern Visayas, no, to the rest of the provinces and cities, no. Eastern Samar, in terms of the 6 provinces, lodge at around 3 to 4th. No, so number 1 pa kasi Samar, Northern Samar, then nag-aagaw minsan ng Eastern Samar at saka Leyte. Kaya lang Eastern Samar cannot compared with Leyte kasi nga malaki ang Leyte, no? So in terms of magnitude, mataas ang magnitude sa Leyte, but in terms of prevalence, mababa si Leyte, mataas si Eastern Samar. Pero sa magnitude ng Eastern Samar, yung Ninfa, yung prevalence kasi is computed. Whereas yung magnitude, mga tao talaga sila na lang, buhay na bata. That is the comparison between the magnitude and a prevalence. A prevalence is based on computation and the magnitude is based on live talaga na bata. So yun. So nasa third, fourth kayo in terms of the entire Eastern Visayas. But not bad because you're at the middle, no? So probably magiging benchmark siya, no? So and then Ninfa, ano ko lang, no, seeing my visit in the entire Eastern Samar for the last 3 days, I would really recommend, no, the local chief executive. Hindi talaga sila mga isnabero. I am sorry, no. I'm sorry for the other provinces who is listening. Ang dali nilang pakiusapan through the MNOW, through PIA, and then through our mga focal person natin sa local government unit. Nakikita talaga natin ang, you know, yung response ng mga local chief executive of the first visit of the National Nutrition Council after the pandemic. No, so I'd like to commend that, no, so the local chief executives.
Labi na yan at local chief executive natin hit may dolo. Mayor Garado at nananagbalayhan yan ang
okay, so yes, I would like to thank the mayor of Maydulong, Mayor Gudi Garado, and the First Lady Municipal Nutrition Action Officer,
okay. Yeah,
my very own classmate, Miss Tessie Bayotas Garado, no, for inviting us to capacitate, no, paghataghin what do you call this, on training and yung mga barangay nutrition scholars para ining mga barangay nutrition scholar makapacitate na to ngan according to Mayor Garado, they would be able to pinpoint real children who are really stunted, mga mubo nga mga kulang ang timbang kasi gusto niya nga makita gud ang tinuod nga picture, evidence-based talaga. And giving this training on basic course for barangay nutrition scholar is really a necessity for our barangay nutrition scholars.
Iniragin tutunduan para kitaan iton pipera ba kada
sitwasyon liwat, no.
Ngan mabaton iton aton local government. Hain ba talaga sa Quirante? Hain ba problema? Hala, sulbarata ini.
Okay, good.
Okay. So, kasumpay naman hiton, parang may ada ni Doc Cathy maupay nga igin istorya kan Mayor Dayan Agda din ha Borongan, nakadikitang Ma'am Alice. Parang duduha nga project, an tutok kainan.
Yeah.
And the multi-sectoral nutrition program. Can we talk about that, Doc?
Well, actually, you know, because of no ang problema natohan stunting, no, basically stunting, no, and wasting in the entire country. Amo ito, the government is so serious, no, in addressing the problem of stunting in the country kasi matatapos na ang ating Philippine Plan of Action for Nutrition 2017-2022 because it commensurate with the sitting president, no? And there are several target set forth in the PPAN and then cascading higher to the PDP or the Philippine Development Plan and to our ambition natin 2040 at saka sa global target natin by the UN, no, SDG. There are four basic no problems that we would like to address, no, of the PPAN and the higher plans, that is reducing stunting among 0 to 59 months old, reducing wasting among 0 to 59 months old children, and then reducing the incidence of overweight and obesity among the same age group, and of course reducing also micronutrient malnutrition such as iron deficiency anemia, vitamin A, and iodine deficiency disease, no, both our children and our vulnerable mothers, no. So going back to the question of Ninfa as regards the initiative, this is actually an initiative of the government, particularly of the National Nutrition Council, in close coordination with the Cabinet Secretary, the Honorable Carl Lexi Nograles, no, who happens to be the chair of the what you call this anti-hunger and malnutrition in the country, no. So I'd like to commend, no, the effort of Honorable Carl Nograles, although it's not coming from the health and nutrition sector, pero nakita niya talaga yung problema natin in terms of stunting and wasting. Now, going to going to that initiative, we already started out the initiative of Tutukainan Dietary Supplementation Program. We started it last year, no, pulling out funds from the NNC, DOH, DSWD, and other related government agencies, no, are members of the National Nutrition Council Governing Board, no. So nakalikom tayo na around 62 million pesos. Kaya lang may nangyari kasing disaster, no, last year, no. So kaya Ninfa, unfortunately, hindi na isali ang Eastern Visayas, no, in terms of the 62 million pooled funds for dietary supplementation to tukainan in the entire country. So, pero alam mo naman, this representation is, dili man gud kita naga Eastern Visayas, gud kita mga waray, dili gud kita napalupig. So, I really have to voice out bakit hindi nyo sasala, bakit hindi kasali ang Eastern Visayas, considering that we are the top, the top on top of in terms of malnutrition prevalence and in terms of poverty prevalence, no. So kaya when this project came out na naman for an expansion, kasi hindi kasi natin maisiguro yung funds, so that towards the end of 2020 nag-commit si well, thank you, Senator Amy Marcos, out of her congressional fund, no, 100 million across the country, no, and of course, one of
even bigger than the 62 million.
Yeah, even bigger by the 62 million. Kaya lang, this is, well, yun, whole country naman yun, pero selected provinces, but yung one kay Senator Amy Marcos is also across the country, but we're just fortunate na naisali ang Eastern Visayas. The Eastern Visayas provinces, apat na province ang included sa 2020 Tutukainan Dietary Supplementation Program. Pero this time, focus on 6 to 23 months old. Yung mga bata na wasted at saka stunted natin, Ninfa ang kasali in this congressional insertion of Senator Amy. So, 4 provinces, including the 3 Samars and then Leyte, no? So, sa Eastern Samar naman, what they call this one, sa Eastern Samar naman, Ninfa, no? So, sana hindi magdamdam ang Eastern Samar, no? Kasi the National Nutrition Council do not have the hand on that, no? And considering the bulk of the entire country and Eastern Visayas, there are only 5 municipalities and 1 city in Eastern Samar that is included in the Tutukainan Dietary Supplementation Program under the 100 million congressional allocation of Senator Amy, and that would include Lawaan, Balangiga, Quirante, and then Borongan City, Canavid, at saka Dolores. Okay.
So, excuse me, sir. 6 sila.
Oo, 6 sila.
Isang
5
city ang
munes, 1
Borongan.
city.
Okay, Lawaan, Balanhigan,
Llorente,
Canavid, and Dolores, tapos
Borongan City. No, so, and then, ito siya ay, i-expound ko na lang, taking the opportunity para ma-explain natin, no? Yung tutukainan is basically a feeding program, no, for the 6 to 23 months, but we are not downloading funds to the local chief exec or to the local government unit, of which receptive naman ng local government units kasi nga nahihirapan sila pag-downloading ang funds kasi usually nagfe-failure in bidding, mahirap mag-liquidate, so nababurden din ang local government unit. Kaya this time we will be, what do you call this one, we will be parang yung NNC ang mag-bulk procurement. Now, the role now of the local government unit is really to check on the delivery given by the National Nutrition Council in terms of quality, yung mga expiry, and then quantity in terms of the number versus the target in that particular municipality. No, so yun yung natin. The feeding would run. The feeding would be 23 pesos per child per day times 120 feeding days. Now, So, well, wala na lang tayong point of comparison with other implementers of dietary supplementation program kasi dinesign na talaga yan. So, please do not compare us with like DSWD o DepEd na medyo much lower ang kanilang allocation. No? So, kasi we would like to run the DSP through our Agrarian Reform Beneficiaries Organization of the DAR.
Okay.
And then kasi they are registered with the DOLE. And as such, they also have yung resibo nila na para hindi mahirapan.
Yes.
And then SLPAs, no, Sustainable Livelihood
Project
Program
Started.
Association, and then
Yes.
other community-based organization present in the municipality that can give us official receipt in liquidating the funds or liquidating the commodities that has been given to said municipality. Now, hindi lang siya Ninfa, hindi lang siya mere feeding program kasi
Okay.
form part of the component is really Nutri-Text blasting, no?
Oh.
Nutri-Text blasting, no? Parang we will probably give, no? So, parang ganito ang how, although we don't have yet the guidelines, but basing on our meetings, no, ito ang mangyayari. So, we will be giving konti lang na data load allowance to mothers, community volunteers and our nutrition workers in terms of giving nutrition messages, bite-size, chunk size, hindi yung napakahaba, meaning parang chocolate, pag ninuya mo, tapos na siya. Then, mas maganda na sa... Yeah. So, chunk size lang siya, chunk bite, no? Messages for...
Chewable.
Chewable. Yeah,
Easily
that's the right term, chewable to the mothers, no? Ibibigay natin siya as soon as we give the feeding.
May
Bibigyan,
message.
may kaagibat siya na text blast, nutrition text blast, like gumamit ng iodized salt. Tatlong words lang yon that will impart to the utok ng mothers, no? So ganon siya. And then Ninfa, another is the TKDSP would also be a platform for other nutrition sensitive interventions such as community advocacy, and then community and budget, community home community gardening,
Ayan.
gardening in the schools, no? And then sustainable livelihood project of various sectors of the government or of the local government units, such as social welfare, agriculture, and other sectors that give out what we call this one, livelihood projects, no? Okay. So, yun yung ibang platform na magagamit ang TK, no? Hindi lang siya feeding, but we can really jumpstart other nutrition sensitive and nutrition specific programs and projects implemented in the local government unit. That's one, no? Kasi pre-pressure ako ni Ninfa. The other one, actually tatlo siya Ninfa na initiative, no? The other ones which I invited the media group and the PIA and the HIMSOG, no, it's actually a feeding program patterned after TKDSP. That's Pilipinas kontra gutom.
Yes,
no?
yes. Pilipinas.
Ano yun?
Gutom.
Lahat kasali, lahat kasalo, lahat kasali. No? So, it's actually iba na naman because this, although the TK is a whole of government approach, but dito sa PKJ or Pilipinas kontra gutom, para kasi nakita ng mga private sector, parang gusto naming mag-assist sa government kasi malapit na si 2022 and we really have a very big problem in terms of stunting. Kaya tutulong na lang kami. No? So it's just fortunate. Pero iba-iba siya, kahit private sector siya, Ninfa, meron siyang kasama ng mga government agencies, no? Like here in Eastern Visayas, ang partner natin is DSWD, NNC, at saka NEDA, I think, and then plus a conglomerate of private sector, no? So, yun lang. Ayoko lang pangalanan yung mga private sector, baka
Pero
sabihin,
halos lahat sila na
yes, nakita ni Ninfa yun,
Oo.
baka sabihin, nagpo-promote ako ng kanilang businesses.
On board.
no?
Everybody's almost
Okay.
on board.
So, pero, that's the second initiative, which is still no part of the concept of NNC and Secretary Carl Nograles. So, yung pangatlo naman, which we are very aggressive tayo, meeting every now and then, is the World Bank loan, no? Tawag nito, sabi nga ni Ninfa, is the Philippine Multi-Sectoral Nutrition Project, or the PMNP, no? We had a meeting ng mga regional heads, no, and other partners, because this will be spearheaded by the National Nutrition Council and the Department of Social Welfare and Development. Yun nga, parang malaki siguro yung, although Ninfa, sinasabi ko na this is the first World Bank loan, if I am not mistaken, na hindi siya infra-related, but human capital development, kasi nutrition. And ako nga, I voted no, kasi utang na naman, wala akong anak, wala magbabayad, no? Si Ninfa, yung apo niya magbabayad.
Yes.
Pero sabi naman, the positive side of it is kahit babayaran pa ng apo mo, is that this is non-infra but human capital development. So, yun, nag-over the background ako, nag-voted yes na ako kasi nakita ko yung rationale, no, na maganda naman.
Purpose.
Although, it was a welcome, hindi na kasi in-erase, sabi ko off the record, hindi na in-erase ng World Bank eh. So, kasali na doon sa answer ko na nag-no ako, but ultimately, I say yes, no, with this project, although wala akong anak. So, yung mga anak nyo na sa Eastern Visayas, apo ang magbabayad, no? So, yun. But what is the beauty of the PMNP? Although, it's still on the conceptual phase pa siya, Ninfa, with a series of meeting. In fact, I had a meeting now 10 o'clock. I have to let my staff to attend the meeting of the PMNP World Bank, because I really have to, I cannot say no to Ninfa, no, and the rest of the PIA. So, yun, pumunta ako rito sa station just to have this. Yun naman concept ng PMNP is dinidevelop pa siya, Ninfa, no? But it is still on. Actually, ngayon, we are conducting focus group discussion kasi yung concept ng PMNP World Bank proposal is that ifo-focus natin sa indigenous people and those people living in a geographically isolated and disadvantaged area.
So, doon papasok kayo.
Yes, similar to what the Kalahi Seeds did. Kasi itong project na ito was taken from the concept of the Kalahi Seeds na, Kalahi Seeds na after nag-take off na ang project ng DSWD, we let the local government unit take over in terms of sustainability. So, gusto nating gayahin yung concept ng Kalahi Seeds with this PMNP. No? So, right now, I cannot still say more of the project component, but suffice it to say, it would really bend on the TK gihapon. No, but probably there are other jumpstart nutrition-sensitive interventions also under the proposed World Bank PMNP, Philippine Multi-Sectoral Nutrition Project. So right now, we are conducting, kasi form part of the initial survey of required by the World Bank is to conduct a focus group discussion, each one from the target municipalities, no province. Anim pa, no, so the province na may include na naman sa PMNP would be the 3 Samars and Leyte, no? So
all of the municipalities na
hindi pa rin. Kaya lang nakita ko sa Eastern Samar from 6 to 13.
Okay.
Oo. Parang meron tayong ida-draft from the 6 and then magpupuno na naman tayo. No, to complete the 13 local government units. So right now, we're conducting a focus group discussion. We are done with Leyte and Northern Samar. We hope to conduct the FGD for municipal, barangay, and provincial implementor in Eastern Samar today. But we're really running out of time. I told Archie, my senior nutrition officer staff na probably will go back na lang para hindi man madalian kasi it's only 45 minutes pero pag binaybay mo yung FGD, it will run around it will around 3 hours talaga, Diyos ko dahil. So anyway, we'll go back and then we will also be conducting a Ninfa focus group discussion taken from the target beneficiaries, who are the indigenous people. No? So we identified one in Batulete, mga Badjaws, and one in
Samar, meron
it's in Basay.
Tagbanwa.
So, pero huwag kayong mag-alala, kahit wala kayong IP, you were included kasi may mga GIDA areas naman similar to, as I've said a little earlier, sa Kalahi Seeds concept. No? So, ganon ang mangyayari. Hopefully, NEDA is also assisting us to aggressive para ma-approve siya ng... Pero, since marami ng series of meeting, I hope World Bank is really considering the proposal. It would run from 2022 to 2025, no? Around 4 years, but we will be starting the social preparation probably in the second semester of 2020 because it would require human resources, no? So, yun lang ang mga pauna kong what do you call this one?
Pahapyaw
na concept ng Philippine Multi-Sectoral Nutrition Project. I hope, please help us in praying na mag-go na talaga siya. So we are so very busy. Every week, meron kaming small group meetings with World Bank people. So that's actually the 3 initiatives.
So can we summarize them, Doc? So yung una yung tutok
kainan.
Pangalawa itong
Pilipinas kontra gutom.
At itong the third
PMNP, Philippine Multi-Sectoral Nutrition Project.
Okay. Can we go back, Doc, to the tutok kainan? Nag-start na ho ba ito?
Kaya nga pasensya na yung mga Nutrition Action Officer na makulit kami changing reporting mechanisms kasi nga the concept is 6 to 23 months. Ngayon, hindi naman tayo nag-uumpisa agad. Nung sinabi nung December, uumpisa tayo ng January. Hindi We might, probably we are into social preparation, mga MOU. That's why I roam around Eastern Visayas, including the 6 municipalities in Eastern 5 municipalities and 1 city in Eastern Samar. Fortunately, natapos ko na yung one-on-one orientation with the local chief executive and I already handed and give them through emails the prototype MOU para hindi na sila mahirapan. They'll just fill up after authorizing our local chief executive by the respective sangguniang panglunsod at saka sangguniang bayan. So that's how hopefully we can start this by towards the last week of March or early June.
Okay. Yung feeding mismo.
Yung feeding mismo.
Okay. So, do we have a target as to how many children itong ating tutok kainan here in Eastern Samar?
Actually, sana lahat ng stunted, putot, lahat ng wasted, magasa, or both. Kaya lang, hindi kasi pare-pareho ang amount that will be given. So, and then, hindi rin pare-pareha ang number of barangays. So probably what I already told the local chief executives and the MNOW na probably on a priority basis na lang. Kung sinong mauuna na mga high prevalence na mga barangay in terms of wasting and stunting, so sila mauna. Then kapag may sobra pa, then we feel, no? If we feel na lang yung sobra pa na funds for that particular feeding program.
You think it will work, Doc?
Well, kaya nga Ninfa, hindi i-maximize na natin not only feeding but sinabi ko nga kanina, platform for for other nutrition
Parang
sensitive.
this is new, no?
Oo, jumpstart
textlasting.
Jumpstart ng other nutrition sensitive at saka enabling program under the PIPA, no? So, yun. So, and hindi lang naman yan kasi policy din is included, no?
So we have meron na tayong nakaandam na mga messages that will be
Yes, because UNICEF is also actually the National Nutrition Council is actually now developing the framework on social behavioral change, no? So kasi yun yung importante eh. So unfortunately we are on the baseline survey pa. But they are now on the process of drafting messages. And then they get some messages also from other member agencies of the National Nutrition Council governing board, no? So yun.
Okay. So, ang tutukainan will start a little later. How about itong program, Pilipinas Contra Gutom?
Yun na eh. I've been telling central office people, parang natabunan ng PGK ng PMNP, ng Philippine Multi-Sectoral Nutrition Project. So, probably kasi malaki-laki na fund. Well, I'm not saying na hindi rin malaki yung pondo considering the bulk or conglomerate of what do you call this one, private sector, no? So laki-laki din siguro yan na. Pero then what is good with PJK and Ninfa is that from the 4 provinces, kasali na ngayon ang Southern Leyte. Because Southern Leyte is at the tail end in terms of tail end siya, pero maganda na tail end because they have a better nutritional status in the 6 provinces and 7 cities, yung sa Maasin City. Sila ang nasa pinakamababa na malnutrition rate.
Okay. Okay, so ano na ba yung mga tanong kong iba kanina? I started to write kanina my questions. Nasaan ba yun? Nawala na. Okay. It's here. So, remember, we have 3, tutulo, ang aton mga
initiative.
Initiative na-mention na nga ni. Okay. Para naman, Doc, haimo, ano ba ang mga maupay nga? Of course, din Eastern Samar, I'm sure may ada mga municipal nutrition action officers nga mag-upay. Ano nga ni, may ada man niyo gin-recognize. Ano man ira mga para ito naman diri para itong damo itong wasted, damo itong stunted, undernourished. Ano ang mas maupay nga ginbubuhat kunta para manhibaro naman lahiran?
Well, number 1 is really policy, no? So policy in terms of structure, organizational structure, like making our local nutrition committee to be functional.
Yes.
That's number 1. Over and above also the policy adoption such as Universal Healthcare Law, Republic Act 11148, or the Kalusugan ng Nutrition na Magnanay Act, and Milk Code and other very important instruments already approved, no, in terms of Republic Act na siya, no. And then after policy is actually, and then policy on organizational structure is in terms of HR naman, yung manpower complement, no?
Okay.
And I am very happy to report, no, I hope marinig tayo across 6 provinces.
Yes.
that the city of Borongan is so serious, and in fact the good mayor Diane Agda is really bent on creating a municipal nutrition action officer with separate office, separate budget, and
staff.
Staff complement.
Oh.
Then
budget maybe.
Yes, and budget maybe at a later time. No, although we can get the budget out of the sectors, no, like SWD, agriculture, health, DepEd, and other member agency of of the local government unit. But we are also geared towards having a separate budget for nutrition. Hindi lang yung 50,000 to be used
Dapat
for...
milyon.
Yes, to be used
Diba,
for...
pero parang narinig ko si Mayor sabi, if you have 1 million, I can give you 3
yes,
million. No?
yes,
Parang,
okay. Parang ganun. Maganda yung ano. And then, when we moved out from Borongan, pumunta kami sa... Ano ba yung munisipyo kahapon, no? Kalimutan ko lang.
Northern?
No, dito, doon, yes, northern
San Julian,
part.
there's San Julian, Sulat, Ta.
I think, kasi ano siya, yung ano...
Sino yung mayor doon?
Yung, lawyer, ang kanyang legal legal ano. I think yung nauna after this.
San Julian.
San Julian? It's, San Julian ba?
Sulat, may Ta.
Ay,
Naalala ko naman yung Ta.
I think sa top. Kasi meron pala silang approved resolution as of to date creating an item for Nutrition Action Officer. No?
Okay.
So,
Walang
binuha
designate.
namin yung we are getting the same instrument para may pasamwak namin
Sa iba.
sa ibang provinces, munisipyo. How did this very small municipality in Eastern Samar, well, not to compare Borongan City, came into proposing and approving an item of Municipal Nutrition Action Officer na hindi naman sila ganun kayaman.
Oo.
No?
Pero it can be done pala.
But can be done pala, no? So, gusto namin kunin because according to the M now, who is from the MSWD, although hindi naman siya nag-aano doon sa item naging create, it might be another person, pero she also had a hand in the really approving that particular instrument on the, what they call this one, on the creating an item for Municipal Nutrition Action Officer. No, so I would like to commend that particular municipality.
Kaya lang hindi
no?
niya matandaan.
Pero di ko matandaan sa dami ng pinuntahan ko. Sino ba yun?
Okay.
Basta nag-birthday yung asawa niya kahapon.
Sino kaya?
Sino ba yun? Sorry, wala kasi si Archie. Mahilig ma-memorize si Archie.
Okay, it's okay.
Oh.
Okay, so medyo kinakapos na tayo ng time. So, maigsi lang pala yung time, no? Pag nutrition ang pinag-uusapan. Okay. So, sige, Doc Cathy, baka meron kang gustong sabihin na hindi ko naitanong. This is your chance.
Okay, so for the entire, actually, Ninfa, hindi lang natin na-meet si Governor Ben Ibardone at saka si
Out-of-town
Representative Fea Abunda. Although one of our target is really for Congresswoman Fea Abunda, our advocacy, na sana naman supporting policy instrument or Magna Carta, Barangay Nutrition Scholars, kasi nakatenga na siya for quite a decade or two. No, gano'n naman talaga ang mga Republic Act, no? Namamatay yung mga original proponent dahil 24 years na hindi pa na-approve. So, we are still very hopeful, no, na ma-approve itong very important instrument that would really support our nutrition warrior in the barangay through our barangay nutrition scholars, no? And likewise, no, we would like to what we call this one, emphasize, no, in terms of organizational structure and functionality of the local nutrition local nutrition committees, no, in each of the barangays and the municipio. Through anyway, it is monitored by the Department of Interior and Local Government kasi yun naman talaga ang kanilang mandate, no. Ours is just the instrument of functionality being in the nutrition sector, but it's really the ILGUs doing that, no. Anyway, yun na. And then please, for the local chief executive, although marami ditong nagbo-boost, no, nangahambog ang ilang ang kanilang mga
Program.
nutrition PPAs, 1 million, 2 million, 4 million, sabi ko, ha? So, yun gusto. Hindi lang yung 50,000, please, Mayor. Huwag naman 50,000 lang for nutrition, July Nutrition Month celebration, no? You can take that out of, meron akong M now. I think it's, where is Mayor Buko?
Dalawa yung,
Yung
Llorente.
Iyon.
Land.
Diyos ko dahil, ang laki-laki ng kanilang DSP, 1 million taken from their God
Ano yung
budget.
DSP?
Dietary supplementation program.
Ah,
Both
okay.
for pregnant and 6 to 23 months old. Ang
Wow.
yabang, pero good. Congratulations.
You have met the mayor?
Yes, I have met the mayor and he's very attentive when I did my discussion on DSP. Although meron na pala silang appropriation for dietary supplementation program in the amount of 1 million. And what is good, sabi nila, Doc, we will really spend the 1 million kasi tatanungin kami ng God, bakit hindi nyo inubot?
Oh.
Well, that's good. Ba? So, there are other municipalities, kaya ginaaghat good naman mga local chief executive really to invest more on nutrition. Kasi human capital development investment
Human
yan.
capital development
No,
investment.
so meaning, yung mga future generation leaders would not be stunted because what comes out with stunted is brain development. So, hindi masyado develop ang kanilang brain kung when they become the future congressman, the future, parang ganon, leaders no, in Eastern Samar, no?
Okay.
So, anyway, yun, and then, meaning, invest more on nutrition in their, not only in the plan, kasi yung plan lang yan.
Implement.
But in the annual investment program, kasi the AIP is the money component of each and every sectoral and comprehensive development plans. So, yun ang aking advokasya to our local chief executive, not only to provide funds on sectors, but also specific for nutrition component.
Okay. So,
Pwedeng last lang.
Sige,
I would like to take this opportunity to send my birthday greetings to, birthday ngayon ni Sol.
Sol,
Oh.
nasa Gandara si Sol.
Happy birthday, Sol.
Sana makita kita Gandara.
Okay, so, sige.
Okay. So, that's from?
The National Nutrition Council, Region 8.
And he is?
Dr. Catalino Catipidotolio Jr. No, marami akong classmate dito, no. Nag-courtesy call ako sa mga ate ko, no, all over Eastern Samar. And my former colleagues in the Department of Health because I used to work with the Department of Health.
Okay.
Thank you, Ninfa, for quite an opportunity of spreading tutukainan in Eastern Samar. Thank you, Ninfa, and the rest of the Philippine Information Agency here in Borongan.
And thank you also, Doc Cathy. It's a pleasure and an honor. And pinagihinisang kay, pinagikan Doc Cathy National Nutrition Council. Ako Ninfa Barcena, Quirante na sa ring tugtog ngahaw, hasunod na PIA Hour.